Kaylee Burkus looks like any typical recent high school graduate, bright-eyed and full of energy as she spends time with her family near her home in Riverside, California. You would never know it now, but Kaylee suffered from scoliosis as a child and required surgery in August of 2017. It would take the love of her family and Dr. Samuel Bederman to get her through.
I didn't notice her curvature until her gymnastics coach pointed out to us, because she was such a competitor and she was at gymnastics for so long during the day. I never even saw her in the positions that you would actually notice scoliosis. So then we took her to a chiropractor that specialized in scoliosis. He suggested we use a soft brace and try to correct it with the brace and chiropractic care. She went through a couple braces and it kept just getting worse and worse.
Hi, my name is Kaylee Burkus and I'm from Riverside County. Being active for me when I was growing up, it was probably one of the most important things to me besides my family and my education. Growing up, especially nowadays with social media, you get this certain body image, and it sucks having a deformity, also dealing with body issues and stuff like that.
Seeing Kaylee in pain through all this, it hurt me more than I think she even realizes. It's the last thing that you want for your child, is to hurt and to be in pain, and I would cry at night for her because I know how much pain she was in, and I felt it. As a mom, you just have that motherly intuition, and you know you've got to do what you can to get her out of the pain.
Well, when we found out that I had scoliosis, I went to a small school, and so everyone knew everyone, and we all kind of joked about it. They said I was a hunchback, but I would say that too. So I just kind of laughed with them instead of them laughing at me.
So then we kind of researched a little bit more after we noticed it was getting a lot worse, and that's when we found Dr. Bederman.
When Kaylee came to me, she had a severe curvature of her spine called scoliosis. It involved the majority of her spine from the base of her neck down to her low back. She had a big rotation to her spine, a severe hump on the right side of her back. After seeing Kaylee's situation and the size of that curve, we decided the only option was surgery.
The day of Kaylee's surgery is very emotional for both me and my husband. We were scared. I was, just the risk alone, being so close to her spinal cord and how deep her curve was, I was just a mess. Because knowing one of the risks is that she could never walk again. So after the surgery, seeing her in the ICU, hooked up to so many different monitors, and it's scary, your heart breaks because you can't help her. You want to take all of that away, and you can't. And I cried so many tears seeing her that way.
In order to fix Kaylee's scoliosis, we had to put in bone screws as anchors into each of the vertebral levels of her spine. These are called pedicle screws. Once we had our anchors in place, we were then able to use rods to rotate and correct her spine back into a normal position.
The first time I saw any improvement was when she walked at the hospital the first day after surgery, the day of surgery.
You feel okay? Good job, Kaylee. All right. This will be your...
Months after Kaylee's procedure, she was eager to test her abilities and see if she can get back at doing some of her favorite sports. While we were at Kaylee's sister's cheer practice, I saw Kaylee at the tumble track and she calls for me and says, "Watch this, Mom." I was concerned because she looked like she was ready to do one of her flips that she used to do so well. As I saw her start to make her way down the tumble track, I braced myself for what was going to come next. That moment of her flip, I knew that nothing could stop her.
It's great to see Kaylee going back to the things that she enjoys. I'm grateful that I had a part in helping her and her family get through this.
Being able to see Kaylee back enjoying what she does and be able to do it and be out of pain is just mind-boggling. And the amount of thankfulness and that we have for Dr. Bederman is, words just can't describe that. It's good to know that at the end of the day, Dr. Bederman always has our back.